So the MonumenTAL-2 pivotal trial included 3 cohorts. All of them had single-agent talquetamab, a GPRC5D targeting bispecific antibody. Cohort A had a every week dosing schedule. Cohort B had a schedule of dosing every other week. And Cohort C distinguished itself by having patients in it that had received prior T-cell redirecting therapy, which were excluded in Cohort A and B. So all of these patients received single-agent talquetamab. All of the patients had to have had prior exposure to an IMiD, proteasome inhibitor, CD38 antibody, and must have had at least 3 lines of treatment. So we're dealing with very we're dealing with with patients that have had quite a lot of pre-treatment before entering the trial. I think for sure the response rates of these bispecific antibodies, or the talquetamab as used in this trial, is very impressive. So Cohort A and Cohort B response rates were around 70%, which is, I think, is really exceptional for a single agent. Even Cohort C, so those patients that had prior T-cell redirecting treatment, overall response rate was 65%, so still also very good. And I think that's very encouraging for these patients, that there are still options available which previously were not. Yeah. These patients with heavily pretreated relapsed refractory myeloma have an unmet need, because there's really, before the introduction of these bispecifics, there was really little we could do to salvage them, to give them further treatment. So now with a bispecific antibody treatment, or the talquetamab, as in this trial in particular, you have a very viable treatment option that has significant response rates, has also an impressive duration of response, which is, depending on what cohort, 9 to 11 months, has impressive progression-free survival. Again, up in Cohort B, it was up to 55 months. So I think these novel therapies are definitely changing the landscape. And some of the patients we enrolled into the trial, otherwise would have gone on hospice. And so I think to have an option in that situation, and really to have a life-extending treatment without significant adverse events, I think is fantastic. Some of the adverse events are similar across all bispecific antibodies, particularly the CRS. The cytokine release syndrome is seen in up to 80% of patients. However, grade is very low, 1 or 2, so usually not severe, usually very manageable. The same with ICANS, neurotoxicity especially the initial priming doses, is very rare, less than 1%. So I think we are very able to manage those. Then there are side effects that are quite specific to talquetamab and have been reported previously. So particularly nail and skin changes, as well as dysgeusia, which means that they're not able to taste their food the way they used to. So none of the patients had to come off trial because of these side effects. Some of them are, especially the nail changes, the skin changes, a little bit more cosmetic and can be ameliorated with supportive care like hydration and cream. Dysgeusia tends to be a little bit more bothersome because patients are not really able to taste their food. Though a lot of them are able to eat, they're not really tasting their food. So I think we would need to explore a little bit further how that actually impairs their life quality, and particularly is there anything we can do to improve that side effect. There's nothing so far we can really do to help with the dysgeusia. Talquetamab and other bispecific antibodies are clearly going to be established in relapsed refractory multiple myeloma. I think there's also now there are clinical trials ongoing to move these drugs into earlier lines, maybe even up front. So I think that will be very exciting to see what happens. I think for standard risk patients up front, we have so many options now. It's maybe a good problem to have so many available drugs. I mean, again, in the relapse refractory setting, I think it's going to be changing the landscape because it's just so effective in this patient population that, again, historically did not have a lot of options. We were really impressed when we used this drug on our patients. We were impressed by the response and also by the tolerability. So yeah, we're very excited to move forward and be using it also in our clinical practice.